My name is Mike Jensen. I'd like to welcome you to the Unanswered Maydays podcast. We have a special session today where we're going to actually talk to some researchers who are working on the Texas Firefighter Cancer Study. This is a unique study, and you'll get an opportunity to hear right from the researchers what they're doing and how this is going to help firefighters across Texas. But we'll also, I think, see that the research that they're conducting will also help us to understand firefighter cancer across the United States and I think worldwide. Many of the things that they're looking at are really the same issues that we see across all firefighters, all fire services that are operating today. So without further ado, I'm going to ask them to introduce themselves and we'll get into the podcast. So I'm going to ask to start with Captain Gabe Dominguez from the Houston Fire Department.
Well, good afternoon. Thank you, Mike, for taking time to bring us on board. So my name is Captain Gabe Dominguez. I'm a Houston firefighter, and I'm also a director here with Local 341, the Houston Professional Firefighters. I sit on the Health and Safety Committee. Been on the job with the fire department now for 25 years here in Houston, working out of Station 50 on the A shift. So talk about the Texas Firefighter Cancer Study, the why, right? Why Texas? Why firefighters? So Houston's very unique, right? Houston has the world's largest medical center. So with the medical center comes research, treatment. And with that, we have UT, which is leading the cancer research on this project, right? We partner with the UT because they're statewide. The Texas Firefighter Cancer Study is a Texas firefighter, and we're not going to say that it's going to be just limited to Texas. It's going to go on wheels. Hopefully, it's going to go throughout the U.S. But this data is going to travel everywhere across the U.S. and Canada for firefighters. So, and also why cancer? So, cancer is it's leading when it comes to line of duty deaths in the fire service. We're 9% higher to receive a diagnosis than the general population, right? And every year we go down to Colorado Springs to memorialize our brothers and sisters of that are firefighters that go on the walls there at Colorado Springs. Most of those names that are going on the wall, 80% of those are contributed to an occupational cancer that that firefighter received on the job. So how do we correlate all that? The international, which is IARC, the International Association of Cancer Research, classified firefighting as a group 1, very carcinogenic to human life. It's the highest level. So with us having the world's largest medical center, also having UT in our backyard as a research, we wanted to build that bridge with the medical community, right? So we reached out to the medical community, which is UT, and we looked at getting research done for firefighters. In Texas, we're limited to 11 presumptive cancers. Some states have about 23, 24. No, they have higher numbers, but we need to provide that data to get there. So what we did is we reached out and we built a collaboration with UT, and the lead PI of this project is Dr. Juying Wong, and we helped put together an operational plan for the Texas Firefighter Cancer Study. We started by wanting to address the metro departments and looking at trying to get to 700 firefighters and looking at different biomarkers. So we've done our first round of that. We grabbed about 548 firefighters across the state, and we still haven't done the Houston active firefighters yet. It is a 3-part cohort. We are looking at cadets, active firefighters, and retirees that are part of this study. We're going to get close to about 1,000 firefighters total when we're done with all 3 rounds of the study. We go in and assess these firefighters and do the labs every 6 months for a total of 3. And the scope of work is we're looking at 3 different parts, right? We're looking at doing a carcinogenic assessment. We're looking at the epidemiology side of it. And then we're looking at best practices and screenings for firefighters. That's what we're wanting to get out of this study for when it comes to firefighters. And we also would like to put, like I said, at one time, we'd like to reduce the names of firefighters that go in that role every year in Colorado Springs, right? If we can put that out of business, it'd be great. right? I mean, that's the mission, right? And like Mike, you said best, you're in the business of mitigating, right? Well, we need to start mitigating cancer, right? We got to reduce it, right? There's a lot of tools to put at it, but we got to reduce it. So that's that's what I got us started going on the research side is us getting to build that collaboration with the researchers. And that was phase one because firefighters are subject matter experts in firefighting, but we're not subject matter experts when it comes to getting data, being able to do the research, right? We got to understand what our limitations are. And the biggest thing that I think for us was to go get those SMEs, which was the people in that medical community.
And Gabe, just one question. So funding for this study came from where?
So the funding came from a Senate bill through the Appropriations Committee here in Texas. So that's where the funding came from.
And the amount and the number of years?
It came for 5.1 million for 2 years, and we'll have to this coming year do a report.
And that's significant because I think this is the only state-funded firefighter cancer study that I've ever heard of, where the state legislature came forward and invested in firefighter health in this way.
There might have been Arizona that's done one, but I don't think anyone's done that amount of 5.1 million. So it's Texas, Mike. Everything in Texas has to be big.
That's be bigger.
Right?
Be bigger.
So I think, glad our representatives there at the Capitol decided to do it the Texas way and go big, right? Which gave us a big head start, right? To get a big amount. The more amount of participants that we have, the better data that we're gonna have. But everything takes time and money. And the great team, like I said, that UT was the reason why they were chosen when I sat down with them is because we knew that we were going to go across the state, and they're also laid out location geographically through the whole state because we use different labs. As soon as we're done with those, and Juan and Victoria are going to go into that part, but we use UT's labs when we're done doing the sampling at these different cities. So yeah, the funding comes from the Texas Legislature is where our funding's coming from, and like I said, they decided to go big in Texas, and hopefully they keep on going big. So,
Well, congratulations on achieving that because I know that was a lot of work to be able to approach the legislature and then also to pull the partners together. So, and I know for one, as a firefighter, I appreciate the work that you've done, Gabe Dominguez, personally in helping to promote health and safety of firefighters, and glad that we have with us today two of the unsung kind of hero researchers who are helping us to look at how we can better understand firefighter cancer and look at ways that we can mitigate the impact. So, Victoria, if you wouldn't mind introducing yourself, and then Juan, if you would after, and then maybe talk about your roles in this study and what you see the study being able to accomplish.
Hi, thank you so much for having us. I'm Victoria We. I am one of the research engineers of the Texas Firefighter Cancer Study. The study is very important, and we're hoping to have quantitative measurements of carcinogen levels, biomolecular biomarkers, and another unique aspect of our study is that we are able to link the firefighter payroll number with the amount of fires that they respond to through the Texas Cancer Registry data. So that will also give us a lot of insight for our study.
Hey, Mike, thank you for having us. My name is Juan Alvarez. I am a research engineer as well for the study. In addition to that, I'm also a PhD candidate. Some of my focus on my dissertation is firefighter exposure as well. And yeah, I really hope that this study, given the uniqueness of it and the amount of information that we're getting, that we're obtaining from the firefighters, I really hope that this really reshapes policy. I really hope that it can provide stronger equipment standards, better protective practices, because I really believe that this study will provide real evidence-based results that will create real policy.
Again, thanks for both of you for the roles that you're playing. So tell us a little bit more about the type of information that the data that you're collecting and how this may be different from previous studies that have been done in the past.
Yeah, so like Kate mentioned, we're collecting many biosamples. So we're collecting a lot of matrices that we're able to analyze. So some of those are blood, urine, saliva, nasal samples, skin wipes, skin tapes. And we're not only collecting this one time, we're collecting this 3 times for each firefighter that we enroll in the study. So the longitudinal aspect of this is also very important, very crucial. So we're collecting all these matrices, and from these matrices, we are able to analyze them. So part of our jobs is to analyze these samples using a very sophisticated technique through a machine called a GCMS-MS. So it's a gas chromatography, which basically measures the chemicals in whatever samples we're analyzing. So at the moment, we are analyzing skin wipes, skin tapes, and urine, and we are focusing on a chemical called PAH, polycyclic aromatic hydrocarbons, which are known to be carcinogenic and which are known to play a major role in occupational firefighter exposure. So that is what we're working on now. Of course, we'll be looking at other chemicals as well, but that is what we're currently focusing on.
And
Yes,
so,
and these biosamples.
go ahead, Victoria.
These biosamples also measure different types of exposures, such as dermal inhalation and ingestion. So these exposures will give us a lot of insight based on the type of exposure that they are.
And so you're collecting it 3 times. So for active firefighters, you're also going to be able to look at how that exposure and the exposure pathways kind of accumulate over that 3 different period of time. So over a 2-year period of time, you'll be able to actually see how repeated exposures will impact the markers that you're collecting, correct?
Yes, so we have our initial sampling, then a 6-month follow-up, and then another 6-month follow-up post that initial 6-month follow-up, meaning that it's 1 year after the initial sampling. This allows us to compare the cadets before they were exposed to their first fire, after they were exposed to their fire, but also the cadets versus the retirees, the cadets versus the active firefighters versus the retirees, so we can get a full picture.
And the potential for expanding this beyond the 2 years, is that a possibility with the legislature part of the plan?
Yeah, maybe Gabe will be able to answer that.
Yeah. So, Mike, that's our vision, right? We'd like to make it a longitudinal study, right? Because the longer we go, we're going to be able to retrieve more data, which is going to mitigate, our high risk, for cancers. So that's definitely we're going to try to go back to legislative and secure funding, as well as looking at on the federal side on the FEMA as well, to look for money to support it, to turn it into a longitudinal study like some of the other past cohorts have gone for firefighters for different things. I think the longer we go, we're going to get a bigger picture of what happens to firefighters, especially when the risk it's going to go higher when it comes with age, with cumulative, because firefighters don't work. They're the firefighters for a long period of time because they're career work employees. They stay on the job for 20 to 30 years. With that comes their age, that most firefighters are doing the job to about the age of 55. And they start really young. We call it the firefighters have the healthy worker effect, especially a lot of them that are civil service. They have to come into the fire service before the age of 36 and be graduated, take the oath of office before the age of 36. So most of the firefighters that are coming into the job have no pre-existing conditions. And they're getting on these on the fire apparatus and getting exposures at such a young age, right? You're looking at firefighters around 20 years old. I mean, here in Houston, you have to be at least at the age of 18, have a high school diploma and 15 college hours. And you can all have that by the age of 18. So, and our workforce here in Houston is very, very young. You look at our academies, it's most predominantly, it's all in the early 20s. We have very few 30-year-olds that come in on the job here in Houston. Now, I don't know what it looks like in other departments, but a lot of the metro departments, they have that civil service commission that applies to them at the age of 36. So it's looking at the data, and I'm so glad that we're able to look at it in so many different ways, like Victoria was saying, right? The comparables to what happens when you come in as a healthy worker effect, and then when you reach the different milestones of age and service of what your body is doing. And that's why we needed to go past 2 years, because things change to our firefighters. They're going to make different fires. They're going to be exposed to different fires. Another thing that we didn't have years back is we didn't have these lithium ion batteries, right? What does that do to our firefighters? Now we're starting to make those fires, right? That's a different type of an exposure that we didn't see 10 years ago, Mike. I mean, now you're seeing it, right? We have homes that are or have these huge batteries as energy backups, right? What's that exposure when one catches on fire? The same thing to these the Amazon delivery trucks, right? Those are all battery vehicles that catch fire. What does that exposure look like versus fuel, right? It's just a different type of fuel, even though it's a battery, right? And what does it do to the firefighter? I mean, we have to research it and see what it does to them, and then especially going cumulative, right? We're probably not going to have an answer on the first 2 years, but if we can go 10 years and kind of follow this firefighter through his career, or at least half of his career, we're not saying we're going to turn it into a 20-year career, but it'll give us a really big picture of what's going on to these firefighters when they're getting exposed to these different types of, like I said, Mike, it's the exposures are different. The synthetics, your furnishings are different, right? Firefighting has changed, right? We used to fight back in the early days. It was fuel limited fires, right? Now it's vent limited because homes are insulated better than most. And the other thing is now furnishings have changed, right? Everything was a lot of it was wood. Today, a lot of it is plastic, and different coatings on that plastic. What does that do than what wood did in the past? So we definitely are looking at it going
Yeah,
longitudinal.
the exposure's changed, and then also the duration, the intensity and duration of today's fires, whether we're talking wildland fires or we're talking structural fires or even hazmat incidences. It's a new ballgame. And so it's great to have this kind of a research. I'm really impressed, and maybe a little bit more information about how this information is going to be also added to the National Cancer Registry, and that you're collecting information on firefighters for the number of calls, probably the type of calls, and I don't know if they're also capturing the duration of those incidences where there would be potential exposure. But if you could talk a little bit more about that, Juan and Victoria, I'd appreciate it.
So I'm not sure how the data that we're collecting is going to be added to the data set.
Okay.
Yeah, at least I haven't been briefed about that in detail, but maybe Victoria might find out a little more.
Yes. So that I believe will begin up towards the end of our study. Once we have our data, we'll be able to use the payroll ID to link the firefighter to how many fires they've fought and the information that is available on the Texas Cancer Registry, which would also include the types of cancers, which ones are the most prevalent amongst firefighters, as there are a lot of different types of cancers, and the most popular amongst firefighters can include various types of cancers. So we'll be able to also look at the biomarkers that are associated with each type of cancer as well. So there are many different aspects that we can compare and quantitate, and also compare that to the cancer registry for each type of cancer specifically.
And then how many fire departments in Texas are signed up for the study? Gabe, do you know, 6 or 7?
So we start off with the 7 metro departments, right? It's going to be San Antonio, Austin, Dallas, Fort Worth, Brownsville and Harlingen, and El Paso. And now we're doing the greater Houston area, which includes Baytown, which we did today. We have Pearland, Sugarland, Cy-Fair, and the Woodlands.
Wow.
Yeah, so you're also going to have, and that's the thing that we're also going to have, and how we're not there yet on some of this data information, but we're going to have metro, and then you're going to have smaller departments. So you're going to have a lot of information and data to see, from some of the metro departments to also what's going on the suburban departments, right? We would call them suburban departments outside of the greater Houston area. But they also go through a survey, Mike. They do have a questionnaire that we have several different questions in that questionnaire it goes in pretty depth, like even as when was the last time they grilled meat, it looks into that because it can affect the biomarkers. We go into there's structural firefighters. They'll write there how many structural firefighters they went on. What do they do after the fire? Do they go through SOP that their department has, right? Or do they just store their gear dirty in the locker? Those questions are asked for cadets, active and retirees. We run them through those questionnaires to see even the retirees when they were on the job, because that's what Victoria was saying. They're also trying to do a comparison to see what has changed in any of these firefighters, whether they're active or retired, so that's another part of a data set or data point that we'll be able to look into and see how those questions were answered.
The other thing, Gabe, is I know that the Houston Fire Department, you've got a pretty good cancer screening system in place for your members, and that has helped find cancers, and departmental members were able to act on it early. I would imagine with some of the biomarkers that are being collected in this study that there may be some early warning kind of signs that would help alert firefighters to conditions that they have. Is that part of the study, Juan and Victoria, is that you may identify some cancer markers that need some addressing with the firefighters that are part of the study?
Yes. So again, one of the aspects of this study, and then the reason why we're recruiting from cadets to retirees is because we want to be able to identify the biomarkers as soon as possible. Because because if we find them as soon as possible, then it'll be easier to treat, and the firefighters will not have to deal with the long-term impacts of cancer and the cost of treatment. It's just a burden that we want to avoid them to have. We don't want them to go through any of this, including their family members. So this is one of the goals as well, to identify the cancer biomarkers as soon as we can.
Wonderful. Well, I appreciate all of you being part of the podcast today. I congratulate you on this study and look forward to the results of your PhD on and then also the survey, the entire study. If folks want more information about the Texas Firefighter Cancer Study, where is the best place for them to look?
Let's see. Gonna look up the
URL.
So it's
Searching Texas Firefighter Cancer Study should pull up the website of UTHealth Houston School of Public Health, and all of our information is on this website.
yes. I was wondering if maybe in the show notes we can have the website.
Yeah.
Link.
I'll make sure I add that, and then I can add that verbally because this is going to be audio only. So
Right.
I'll add
Oh,
that
okay.
as
Yes.
well. So, but they can get it from the podcast, and then I'll also try to look at the summary of the study and the departments that are part of this. And then, Gabe, can I list you as a contact also for the study?
Absolutely, Mike, and we would like individuals to go and to the Texas Firefighter Cancer Study link, and we do a monthly newsletter. So if you want more information, we would love for you to register for the monthly newsletter and follow us by signing up for that monthly newsletter, and we'll let you know. We're also working on a cancer symposium coming in October as well here in Houston. UT is going to be showcasing some of the findings at that symposium here in Houston in October. So sign up. You'll see the different cities when we go, and we have pictures and a description of what happens every month, what's going on with the Texas Firefighter Cancer Study. But I can tell you, we have a very good team. It's UT has some great researchers and doctors, and as well as they did a great job on picking the team. Like with Juan and Victoria, this work wouldn't have been able to happen without the team. So they're all mission focused. So it's good. My hat goes off to Dr. Wong, and her team for picking it out. She selected a great team.
Again, Juan and Victoria, thank you for the role that you're playing, and thanks for joining us today. We ask that everyone stay safe, be kind to your fellow workers, and remember that the exposure doesn't end when the flames go out. Thank you. Have a good day.